Hi, I'm Jerry Kay. Welcome to the Marin County G Channel. The subject today is West Nile virus. Dr. Fred Schwartz joins me. Dr. Schwartz, thank you very much for being with us.
Thank you for having me.
And Dr. Schwartz is the Public Health Officer for the Department of Health and Human Services in Marin County. West Nile virus, Dr. Schwartz, give us a definition. What is West Nile virus?
West Nile virus is a viral illness that's transmitted by mosquitoes as part of a cycle that involves transmission between mosquitoes, birds, humans, horses, and other animals. And West Nile virus has been in the United States since 1999. By now, West Nile is firmly established throughout the continental United States and throughout just about all of California. West Nile virus is important because it is firmly established now as part of our ecology, and it can cause a range of illnesses. While, of course, simply being bitten by a mosquito is not a reason in and of itself to seek medical attention, about 20% of people who become infected with West Nile will have symptoms, kind of a flu-like illness, what we call West Nile fever. Fever, headache, perhaps some muscle weakness, a rash, some swollen lymph nodes possibly. And most of those are self-limited. They'll resolve in about a week or so. But even among those, there are some that will persist for weeks or months with debilitating fatigue and weakness. 80% of people who become infected have no symptoms at all. And then a very small number, about 1 out of 150 people who become infected can have neurological illness from West Nile virus that can involve encephalitis, which is inflammation of the brain and a particular problem for older people who become infected, meningitis, which is inflammation of the spinal cord and the lining of the spinal cord in the brain, a little bit more common among children who become infected, and even paralysis. So West Nile virus is certainly of concern, although the overall day-to-day risk for the average person is on the low side. Part of the reason that that we can say that the day-to-day risk is on the low side is because we have some very excellent mosquito control activities, and that really is the main focus of preventing West Nile, because it is transmitted by mosquitoes. We have to do that on a large scale across the county, and also by measures that individuals can take. So on the large scale, the Marin-Sonoma Mosquito Vector Control District has a very active program of mosquito surveillance involving trapping and testing, looking for areas where there's a focus of mosquito activity, and then testing to see if in fact they are carrying West Nile virus, as well as control measures where least toxic methods are used to try to get rid of the mosquitoes when they're in the early larva stage, before they have the opportunity to become adults. Now, there are many things that individuals can do to reduce their exposure to mosquitoes as well.
If residents have questions, can they call the abatement district directly?
Not only can they call, but the district actively solicits those calls. You may have seen their public information campaign, flip it, dump it, drain it. Individuals in Marin, property owners, are all invited to contact the district if they have problems with standing water, because standing water is an opportunity for mosquito breeding.
How do we prevent West Nile virus?
We're an active population in Marin County, and we promote lots of outdoor activity and healthy living. So we need to take a common sense approach. We know that mosquitoes are most active at dusk and dawn, so where possible we can consider limiting our activities and our exposure. We can use effective mosquito repellent, such as repellents containing DEET, D-E-E-T, or picaridin or oil of lemon eucalyptus as alternatives to DEET. Wearing long sleeves and long pants during heavy mosquito season is another option. And things around our property and our workplaces, for example, making sure that window and door screens are in good repair, removing opportunities for standing water, such as clearing rain gutters and plugged downspouts. Tire swings can accumulate water. Ponds, swimming pools. So lots of opportunities there to take a look around the property, and I would invite our viewers to visit our West Nile website, where we have detailed information and downloadable brochures about all of these things that people can do.
And Dr. Schwartz, is there anything else you'd like to say?
Well, in the 2007 season, the state of California actually saw more human cases than the previous year, although not as many as years prior. Certainly we know that West Nile is well established in California. To date, no cases, no human cases in Marin. We've had a couple of birds. Last year we had indicators about West Nile across the board. We had a human case, we had a horse, we had a squirrel, we had a number of birds, sentinel chickens, which are tested in various geographic locations. All of these indicators. So we know that West Nile is here, and it's another reason for all of us here in Marin County to take a common sense approach, not to be overly panicked about West Nile, but to recognize that it does cause a spectrum of illness, and we do have opportunities to reduce our risk. And our West Nile virus task force has been meeting since August of 2002 to promote education and awareness, to develop strategies for dealing with mosquito control issues, to make sure that the communities are educated and engaged in the process of mosquito control. And it's been very effective collaboration, I think, of not only county agencies, county government agencies, but other agencies across the county, such as the Marin Humane Society, hospitals, the Medical Society, the Veterinary Medical Society. We have some local districts, Marin Municipal Water District, Bolinas Public Utilities District, representing folks out in West Marin, and then the county departments that you would expect, the Health Department, Environmental Health, County Agriculture Commissioner, and of course the Marin-Sonoma Mosquito Vector Control District. For a full list, again, check out our information on the website.
Dr. Fred Schwartz, thank you very much for being on the G Channel. We'll make sure to provide those web links and resources for our viewers. Thank you very much.
It's been a pleasure. Thank you.